All right, dear residents, now in this particular video I am going to quickly discuss about the anatomy of uvea. So what are the parts of the uvea? So there are three parts of the uvea. We have iris, yes, we have got ciliary body, and we have got choroid. Now please remember, if we talk about ciliary body, the anterior part of ciliary body is pars plicata. The posterior part of ciliary body is pars plana, pars plicata and pars plana, right? Now let's start with the iris. Now this is the image of an iris. Okay, how many layers of the iris are present? We are going to do it in a little while. So there are 4 layers of the iris. So 4 layers of the iris are there. Now what is this central part? What is this central part? This is known as pupil. You are already aware of this. You all are very good, intelligent chaps. So this central part is the pupil, right? Now can you see this thing? There is a zone. There is a zone. Can you see this thing, this part of the iris? Yes, this is known as pupillary zone. What do you call it as? This is known as pupillary zone, right? And this part, and I am using a different color, this part is known as your ciliary zone. Why? Because the pupillary zone is near to the pupil and ciliary zone is near to the ciliary body. The ciliary body lies at the periphery, hai na? So this is known as ciliary zone. But the junction of this pupillary zone and ciliary zone, my dear boys and girls, is known as collarette. This is known as collarette. Now you must have heard about 2 muscles which are present in the iris. One is sphincter pupillae, another is dilator pupillae. Sphincter pupillae lies in the pupillary zone. Sphincter pupillae lies in the pupillary zone, while dilator pupillae lies in the ciliary zone. Yes, dilator pupillae lies in ciliary zone. All right, now can you see something? So there are crypts. So at the periphery there is presence of small crypts. Can you see the crypts? Wait, now can you see the crypts? Can you see these crypts? So these are the crypts which are present. These are the crypts which are present. What are these crypts? Crypts are like depressions. What is the relevance of these crypts? I told you iris consists of 4 layers. I am going to tell you the anterior layer of the iris is absent. The name of the anterior layer is anterior limiting layer. The anterior limiting layer of the iris is absent in the crypts, right? Yes, okay. Now along with the crypts there are also presence of furrows. Furrows are concentric. Can you see this? Can you see this lighter ring like structure? Yes, ring like, yes, this. So these are known as your furrows. These are your furrows. These are your furrows, right? Now could you also appreciate that there are some lines? You could also see that there are some lines at the periphery here. So here it is much more understandable. Can you see the crypts here? Yes, and there are some lines which is present in the ciliary zone. These are known as your radial streaks. These are known as your radial streaks. These are known as your radial streak. So when the pupil dilates, these streaks become wavy. They actually depict the underlying of the blood vessels of the iris. When the pupil constricts, so these streaks become taut, become straight. Okay. Now these are your furrows. Is it understandable? So we have done crypts, we have done furrows, and we have done radial streaks. And please remember, now can you appreciate this zone is your what? This is your pupillary zone, and the peripheral part is the central zone. And what is this? What is this? This is known as raphe. This is known as raphe. This is known as pupillary raphe, pupillary frill, right? All right, so this is about your iris. And what are the 4 layers of the iris? So we'll do the layers first, then we'll get back to, yes, Okay, so if I talk about the layers of the iris, so anteriorly we have got anterior limiting layer. I told you at crypts area the anterior limiting layer is absent. What is the relevance of anterior limiting layer? It has got melanocytes. So anterior limiting layer has got melanocytes. It consists of melanocytes. Then we have got stroma. What is the relevance of stroma? It has got nerves, it has got blood vessels, and it has also got muscles. Right? Now the posterior to stroma lies anterior epithelial layer, and posterior to which lies posterior epithelial layer. Now these two epithelium layers are nothing but the extension of the optic cup. We have done it in embryology, right? Now the posterior layer I am talking of, it is formed of the inner part of the optic cup, because optic cup is getting close. Yes, so posterior layer is what? It is the inner part of the optic cup, and anterior layer is outer part of the optic cup. So these two are the layers which are epithelium. But remember, this posterior epithelial layer is pigmented. This is pigmented, while anterior epithelium layer, my dear boys and girls, is non-pigmented. Anterior is non-pigmented, right? Non-pigmented. Oh, all right. Okay, now getting back. Now I told you at crypts area, since there is absence of one layer which is anterior limiting layer, so whenever I would want to do laser iridotomy, you understand? Laser iridotomy, yes, it is done in primary angle closure glaucomas. Laser iridotomy, it is preferentially done in the crypts area because it is easy to laser that area. It is usually done, you have to identify the crypt, then you have to fire the laser, right? Okay, now so this is about the basic understanding of the iris. Now from where does the iris gets its color? The iris gets its color, you must have heard about black iris, brown iris, blue iris, blue eyes. Remember that song, Blue Eyes? Okay, so the color of the iris is actually derived from presence of melanosomes. So in eyes with abundance of melanosomes, the eyes will have dark color. Iris will have dark color. In the eyes with less number of melanosomes, the iris will have relatively lighter color, right? I hope it is understandable. Now this colorate, what is this colorate depicting? This colorate is actually formed, do you know that developing lens is supplied by three branches of hyaloid artery? We have got capsulopupillary layer, we have got anterior pupillary membrane, capsulopupillary membrane, and we have got posterior pupillary layer. So developing, if this is the lens, developing lens, so this is hyaloid artery, it supplies the developing lens. One says it is forming posterior pupillary membrane, then it actually surrounds the entire lens. This is known as capsulopupillary portion or capsulopupillary membrane. This is your posterior pupillary membrane, and there is another layer which lies anteriorly, that is your, which surrounds the developing lens. So this is your anterior pupillary membrane. This anterior pupillary membrane is actually present at the collarette. This actually leads to development of the collarette. If there is persistence of this anterior pupillary membrane, what would you call it as? You call it as persistent pupillary membrane. Persistent pupillary membrane. So persistent pupillary membrane is the remnants of anterior pupillary portion or anterior pupillary membrane of hyaloid artery. Yes, I hope you have understood. So it depicts the presence of the anterior pupillary membrane, which is nothing but the blood vessels. Yes, give me a second, I am going to show it to you. Give me a second. Yes, I'll show it to you. Okay, give me a second, I'll show it to you. Yes, so it will become easy for you to understand, right? Just give me a second. Yes, now wait. Yeah, check this out. I think now you will be able to connect the dots. Yes, can you appreciate now anterior pupillary membrane? Yes, now I think you are able to appreciate. So hyaloid artery, it supplies the developing lens, posterior pupillary membrane, capsulopupillary portion, and anterior pupillary membrane. I hope it is understandable. Okay, all right, okay. So this is about the iris, right? Now I told you from the iris, so there is which part? There is ciliary body. We'll be doing about the blood supply a little later. So from iris we will proceed and it will be ciliary body. Now boys and girls, iris has got 4 layers, ciliary body has got 5 layers. What are those 5 layers? So from inner to outer, so you remember, so there was optic cup which was being formed during the development of the eye. This was the surface ectoderm, hai na? So there was surface ectoderm. Yes, surface ectoderm, and this was your optic cup, right? Now when this optic cup closes, the peripheral part of the optic cup, so it forms ciliary body, then it forms iris. Ciliary body, and then it is going to form iris, right? Now what happens is the inner part of the optic cup give rise to neurosensory layer, which is neurosensory part of the retina. It consists of inner 9 layers. Yes, you know that inner part of the cup forms inner 9 layers of the retina, while outer part is 10th layer, which is retinal pigment epithelium. Yes, so this entire thing later gets fused, the neurosensory layer and retinal pigment epithelium, which forms the retina. Yes, now this cup, when it gets closed, and you know which is the innermost layer of the retina. So innermost layer of the retina, boys and girls, is inner limiting membrane. So now the inner limiting membrane and the inner layers, inner 8 layers, yes, and the outer 10th layer, they all contribute to the layers of the ciliary body. Now you will think, sir, okay, cup is getting closed, you told that ciliary body consists of 5 layers, but these are 3 layers. From where the 2 other layers are coming? The 2 other layers are coming from the mesenchyme, which is surrounding the optic cup. Similarly, you will think, okay sir, you also told that optic cup when closes, it forms the iris. Okay, 2 layers of iris are formed, but sir, where are the other 2 layers coming? The anterior limiting layer and stroma of the iris. My dear boys and girls, my dear residents, it is due to presence of mesenchyme only. So mesenchyme is going to form 2 layers of the iris. Mesenchyme is also going to form 2 layers of the ciliary body. Okay, now if I talk to you, if I tell you about the 5 layers of the ciliary body, the inner is inner limiting membrane. Yes, then we have what? So you will say, okay sir, now 10th layer is retinal pigment epithelium. So that actually tells you that inner is inner limiting membrane. Then the 8 layers which you told will also form ciliary body, so it will be non-pigmented and outermost layer will be pigmented. No, there is something very, very important. So what happens is, so inner limiting layer is this. Yes, then we will have 8 layers which are going to be non-pigmented, and then the 3rd layer from inside will be pigmented layer. Is it understandable? But I told you that if these layers, the cup is going to close, so ideally you will believe, okay sir, that actually tells you that the pigment epithelium which was on the outside, now it will come to lie in the front. during the formation of the iris. So anterior layer of the iris, anterior epithelium of the iris should be pigmented. But no, what happens when there is transition from the ciliary body to the iris? The pigmented epithelium loses pigment and the non-pigmented epithelium gains pigment. That is why in iris, from anterior to posterior, so we have got anterior limiting layer, then we have got stroma, then we have got anterior non-pigmented epithelium, and we have got posterior pigment epithelium. But here, since we are talking of the ciliary body, so it will be direct extension of the optic cup. That is why the inner layer will be inner limiting layer. Then we are going to have the non-pigment epithelium, then we are going to have the pigmented epithelium. So this is the second layer, this is the third layer. Then we are going to have stroma. Yes, then we are going to have the outermost layer of the ciliary bodies, supraciliary lamina. Supraciliary lamina. Yes, now I want to tell you one very interesting part, very interesting part. Now, since you know all the muscles in the body are developed from mesoderm except which muscles, so I told you that there is stroma of the iris, isn't it? There is stroma of the iris. Now boys and girls, the sphincter and dilator pupillae, which I told you, they are present in the stroma of the iris, but they are secreted by anterior epithelium layer of the iris, which means optic cup. Yes, and you know, if you are planting a mango tree, you are not going to get gavas out of it, na? Yes, so the sphincter, yes, the sphincter and dilator pupillae, the sphincter and dilator pupillae, they are not derived from mesenchyme, which is leading to stroma formation. They are actually derived from anterior epithelium layer, which is a part of optic cup, which is a part of neuroectoderm. So sphincter and dilator pupillae are neuroectodermal in origin. Very important. Neuroectoderm, very important question of viva voce, right? So they are neuroectodermal in origin, right? And I have already told you the 5 layers of the ciliary body. This is 1 from inside, 2, 3, 4 and 5. Is it understandable? Now ciliary body has got ciliary muscles. The ciliary muscles are longitudinal muscles. They are circular muscles. So ciliary body has got ciliary muscles. So we have got longitudinal muscles, yes, and we have got circular muscles. Yes, now longitudinal muscles help in draining out the aqueous humor. Okay, so helps in taking aqueous humor out. So it helps in aqueous humor drainage, right? And circular muscles cause accommodation. They cause accommodation. Accommodation, you understand, na? So there are 3 parts of the accommodation: increase in the anterior curvature of lens, pupillary constriction and convergence, right? So circular muscles cause accommodation. I am going to show you an image in which you can see. So check this out. So this is your which muscle? Circular muscle. This is your longitudinal muscle. And do you know, if there is detachment of circular muscle and longitudinal muscle, so what is this known as? This is known as angle recession. What is this? Is the clinical relevance? Angle recession. Angle recession glaucoma, you must have heard about it, or you will hear it when you will go further in your residency. So angle recession is separation. It is separation between circular and longitudinal muscles, है ना? Okay, so this is your angle recession, right? Now, what is cyclodialysis? This is an image of cyclodialysis. Cyclodialysis is the separation of entire ciliary body. Can you see? The circular muscles and the longitudinal muscles, they are separated from the scleral spur. It is separation of ciliary body. And where ciliary body is attached, my dear friends, it is attached at scleral spur. So this is your cyclodialysis. And also I need to tell you, if there is tearing of the root of the iris, so just write a term, if there is tearing of root of the iris, what is this known as? This is going to be called as iridodialysis. And in iridodialysis there will be typical D-shaped pupil. Yes, okay. So these are some terms that I believe you should know. Okay, so we have done about the layers of the iris, we have done about the layers of the ciliary body. Now since we are talking of uvea, so we have got iris, we have got ciliary body, and we have got choroid. I also told you that ciliary body is divided into pars plicata and pars plana. Pars plicata of the ciliary body, यहाँ पे I am writing, here I am writing, pars plicata of ciliary body consist of plications. 70 to 80 plications are there. There are 70 to 80 plications in the pars plicata of ciliary body. And the non-pigmented, it consists of non-pigmented epithelial cells which form aqueous humor. It forms aqueous humor. Aqueous humor is formed via three processes. One is secretion, another is diffusion, and third is ultrafiltration. Secretion, diffusion, and ultrafiltration. Secretion is 70%, diffusion is 20%, ultrafiltration is 10%, right? That is the part of pars plicata, right? Pars plicata of ciliary body. Okay, now once you will move from ciliary body to choroid, yes, once you will move from ciliary body to choroid, now what about the layers of the choroid, right? So how many layers of the choroid are there? So the layer which is just in touch with the retinal pigment epithelium, that is a Bruch's membrane or Bruch membrane, right? And Bruch membrane, then we have got choriocapillaries layer, so one layer, two layer, then we have got small vessel layer. So that small vessel layer is known as Sattler's layer, and large vessel is known as Heller's layer. Just a moment, a call is coming. Hello. All right, so Sattler's layer is a small vessel layer. Heller's layer is a large vessel layer. Can you see the large vessels? Yes. Can you see a relatively small vessels? Yes. And outermost layer is known as suprachoroid. So how many layers we have done? So first, second, third, fourth, and fifth. So these are 5 layers of choroid. Then lies sclera. If I want to kind of step up a little bit, so there are 3 layers of the sclera. Let's do it here only. So it is lamina fusca, which is the innermost layer, lamina fusca, and then sclera. We have got sclera proper, and then outermost layer is episclera. And outside sclera what lies? Don't say conjunctiva. Na. There lies Tenon's capsule. Yes. And then there is conjunctiva. Yes. So we are just doing touch and go to the sclera. So lamina fusca, sclera proper, and episclera. And you already know inflammation of episclera is known as episcleritis. Inflammation of sclera proper is known as scleritis. All right. Okay. So these are about the layers of the choroid. But yes, one thing can be asked, what are the layers of Bruch's membrane or Bruch membrane, right? So there are further 5 layers of the Bruch membrane. So one layer is retinal pigment epithelium basement membrane. Then there are 3 zones, collagenous zones. So inner collagenous zone, central collagenous zone, and fourth layer is outer collagenous zone, and fifth is the basement membrane of the choroid. So these are the 5 layers of Bruch's membrane. 5 layers of Bruch's membrane, right? Okay, now having done this, let's quickly do about the blood supply of the uvea. So the blood which is supplied to the uvea, please understand, it is via 3 main vessels. How many vessels? There are 3 main vessels. One is long posterior ciliary artery. So one long posterior ciliary artery lies on the nasal side. Another long posterior ciliary artery lies on the temporal side. Yes, they are unbranched. They go till the root of the iris. So there are 2 branches. One is your long posterior ciliary artery. I am writing it here. One is temporal branch, another is nasal branch, right? Temporal branch and nasal branch. So they are how many in number? They are 2 in number. Yes. And second is your SPCA. So long posterior ciliary artery, second is your SPCA. They are 10 to 20. Yes, in number. They are 10 to 20 in number. They pierce the sclera around the optic nerve, and they are going to form, yes, they form 10 to 20 in number, and they form choriocapillaries, right? Okay, third is your anterior ciliary arteries. Anterior ciliary artery is 7 in number. How 7? So they arise from superior rectus, medial rectus, inferior rectus, and lateral rectus. So from superior rectus they are 2 in number, from medial rectus 2 in number, from inferior rectus 2 in number, from lateral rectus it is 1 in number. In total they are 7 anterior ciliary arteries. But an important point which I want to tell you is that at the root of the iris there is anastomosis between the anterior ciliary artery. So there is anastomosis, yes, anastomosis between 2 vessels. One is long posterior ciliary artery, another is anterior ciliary artery. This is known as major arterial circle, or you call as major circulus arteriosus. Major circulus arteriosus. What is its relevance? In case of blunt trauma to the eye, the source of hyphema is major circulus arteriosus. So you will write, this is the source of hyphema. Source of hyphema means there. What is hyphema? It is blood in the anterior chamber. It is source of hyphema in blunt trauma. So if there is hyphema after blunt trauma, high chances it is due to damage to the major circulus arteriosus. There is another structure which is minor arterial circle. Which is minor circulus arteriosus. This minor arterial circle lies where? It lies at the junction. It lies at the collarette. So here lies minor arterial circle. Yes, or minor arteriolar circulosis. Yes, so that is the relevance. Another important thing I want to tell you here is, so source of hyphema is one. So what happens is, sometimes when the SICS surgery more specifically is being performed, you need to make a scleral tunnel. There is suprachoroidal hemorrhage. Yes, what is the source of blood in suprachoroidal hemorrhage? Just write here, source of blood in suprachoroidal hemorrhage. So suprachoroidal hemorrhage is a space which is between the outermost layer of the choroid and the sclera, right? So source of blood in suprachoroidal hemorrhage is actually the choriocapillaries. The same capillaries which are 10 to 20 in number, and these are the branches of short posterior ciliary artery. Yes, another important point. Okay, what is the relevance of choriocapillaries? Of course, they are going to supply the choroid. Yes, another important point I want to tell you is that retina has got dual blood supply. There are 10 layers of the retina, 1 2 3 4 5 6 7 8 9 10. The outer 1/3 of the retina means outer plexiform half layer, and the remaining layers of the retina till retinal pigment epithelium gets its blood supply via direct diffusion from choriocapillaries, while inner 2/3 of the retina till outer plexiform layer is a watershed layer. It receives dual blood supply, partly from the inner 2/3 of the retina and partly from outer 1/3 of the retina blood supply. Okay, so inner 2/3 of the retina is supplied by branches of central retinal artery, while outer 1/3 of retina is supplied via direct diffusion of choriocapillaries. Just let me show you an image. Now I think it will make you super clear. Yes, so check out the outer plexiform layer. Are you able to appreciate the outer plexiform layer? Yes, outer plexiform layer is being partly supplied by central retinal artery and partly by direct diffusion from choriocapillaries. So in retina there are two blood retinal barriers. One is the inner blood retinal barrier, which is formed by endothelium and pericytes. One is outer blood retinal barrier, which is formed by retinal pigment epithelium. Why outer? Because choriocapillaries blood has to pass through, has to take the permission of retinal pigment epithelium to enter inside the outer 1/3 of the retina, right? Okay, all right. So boys and girls, this was all about the basic anatomy, blood supply of uvea. And in case of any queries, you can send me a WhatsApp. Yes, you can send me a WhatsApp and you can reach out to me anytime. Yes, you can also be a part of my Telegram group, that is DAMS Ophthalmology Academics. Yes, DAMS Ophthalmology Academics. So that is the name of the handle. You can also follow me on Instagram, and that is I underscore Manish. Yes, all right. So that's all from my side. So I'm going to see you in the next video pretty soon. Best wishes, and keep rocking, keep seeing patients, enjoy your residency, and yes, may you become a great doctor. Yes.